Hello and welcome back to Thrive in Every Season. I'm Scholastica, a registered nurse and a registered psychiatric nurse currently living in Alberta, Canada. If you have returned to this channel after our very first video, which is the introduction video, I love you from the bottom of my heart. Thank you so much for coming back. If you're new here, welcome to the family. This is Thrive in Every Season, where we'll talk about everything mental health, self-care, and wellness. Because the truth is that everything we do, every area of our life is affected or somehow impacted by the wellness of our mind. Therefore, on this channel, we talk about everything that has to do with wellness and mental health across every season of life. Today, we'll be diving into the concept of mental health itself, how it impacts our life, our everyday life, every season we go through. Now we'll start with what's mental health. When we say mental health, what do we mean? A lot of people, when they hear the word or the phrase mental health, what comes to mind first is mental illness. Oh, I'm not mentally ill. I don't have depression. I don't have anxiety. I'm not under too much stress. Therefore, I'm mentally healthy. But I put it to you, mental health is much more bigger than that. Just like our physical health is not just about not being sick or not having a diagnosis. It's about how well we think, how well we feel, how well we function in our day-to-day life. Now, think of mental health like this. It's our ability to manage our emotions, how we handle stress, relate well to others, contribute to our community, and make healthy and meaningful decisions, good choices, and honesty to speak. So it's the foundation of how we live, how we love, how we work, and how we relate with people around us. So, what then do we mean about optimal health? How do you know if you are at that optimal state of mental health? Let me tell you, when they say everybody has their 5 minute madness in quotes, it just means that everybody has a point in their life where they struggle with their emotions. So, what are those signs you want to look out for to determine if you're mentally healthy, if you need to unplug, take care of yourself, and come back? One, to decide if you're mentally healthy, you want to consider how you're able to manage stress without feeling completely overwhelmed. Life is stressful. Adulthood is stressful. Stress is part of life. But how are you able to manage this stress without feeling completely overwhelmed? The second thing is, how do you bounce back after challenges? Life will throw challenges at you. You have season where you are waiting for things to happen. You have season where it looks as if things are not just going your way. But how do you bounce back in the face after dealing with those challenges? And this is something we call resilience. How resilient are you in face of challenges of life? Then another thing you want to look for is relationships. Do you have healthy relationships where you give support and receive support? Are there people in your life that will support you should there be a need? Are there people in your life that receive support from you if they need to? Also, you feel a sense of purpose and direction, even if and when life is not perfect. Things are not going your way, but your purpose, your goal is still intact. You still have that sense of purpose. I still have a reason to be here. There's a reason I'm alive and I'm still going to achieve that goal. So, if you have that feeling of a sense of purpose, then you know that you are moving, you're on the mental health side of the continent. You can enjoy the small things. And we take the small things for granted. The ability to laugh at jokes, laugh at the small things, the little things that happen around us, hanging out with friends and being genuinely happy. You are enjoying those small little things of life. You see a meal and you're just happy that, oh, this is my favorite meal and I'm enjoying it. Or even if it's just a quiet moment, you're able to enjoy a quiet moment without being overwhelmed with thoughts or negative feelings, negative thoughts in your mind. Also, and most importantly, you recognize when you need to rest and you give yourself permission to rest without guilt. So, you know you have seen these signs. You know those signs that indicate that you're under a lot of stress and you just need to unplug and take care of yourself. And even when you do, take unplug and take care of it. So you are not guilt tripping yourself as if, oh, my kids need this and I need to, oh, I'm not spending time with my family. Recognizing that you need to rest, taking time to rest without feeling guilty is a sign of mental health. So if you're not doing that, or you have where you manage to take one day off work, or I'm just hanging out with myself or myself, I'm just going to get coffee and just sit down in nature and just enjoy myself, and you're doing that and you're feeling guilty, you be saying, oh, I think I need to check my mental health. I need to see where am I on this continuum. Am I healthy? Am I driving towards health? Am I driving towards illness? Do I need help? Is it time for me to reach out for support? Now, these signs they don't mean that you will never feel sad. They don't mean that life will never be challenging, or they will never be stressful, or you will never get tired. What they mean is that when your mental health is thriving, your emotions don't completely take over your life. Your feelings, your reaction and response to life's challenges do not completely take over your life. You're able to bounce back. And that's that resilience we talked about. So in every stage, or at every stage of life, how does our mental health come to play? I'll say in childhood, infancy, baby stage, infancy, toddler, childhood generally, the mental health shapes the way kids learn, the way they make friends, the way they feel safe. So it's important that we do things around our kids that help them to thrive mentally. We help them to create meaningful connections with family, with friends, with people outside of the home. They feel safe. And how do they learn? Are we teaching them to learn things in a positive environment? When they make mistakes, how do we react? These are things that build up their mental health and help them to thrive. Because eventually in life, when they become older or they grow older, the things they have learned internally, unconsciously in their childhood impacts what they are going to do as adolescents, as young adults, even as full blown adults and in their later years. So we want to make sure that our kids have the opportunity to grow, to thrive mentally and emotionally. Are we being an emotionally safe space for the children, for our kids? If we are not, it's time to think again. How do we react when they make mistakes? Are we yelling? Are we making it a teaching and learning opportunity for them? Are we validating their feelings? And these are the things that kids need for their mental health to grow. In young adulthood, our mental health affects how we handle independence, schoolwork, even our career stress. Because young adulthood, I'm talking age 19 to 24, 25, um, a lot of things are being thrown at these people. Like us at that stage, we suddenly graduate from high school, we go into higher institutions, post secondary schools, we study, we then join the workforce, and things, life just begin to show you, oh, you're an adult and this is adult life. I'm going to show you, oh, back to back challenges and stress and things. Well, how are they able to cope with that independence without abusing the independence they have? Work stress, the school workload, and all of that. In adulthood, where we have parenting, career, full blown career, caregiving seasons, we are caring for the kids we have and for the adult seniors in our lives. So, how patient are we? Our mental health influences our patience. Remember, as kids, as children, those tools were empowered with those things that we learned and we were given by the kind of nature and nurture balance we had as babies, as children. This is when they mostly come to play. How patient are we now in helping our own children thrive, and in even all balancing the stress that come with caring for others and caring for ourselves, the nurture we give and the nurture we receive, and how we balance all of these responsibilities. In later years, I'm talking seniors, retirement ages, mental health impact how we adjust to these changes. Retirement, loneliness, emptiness, and all of that. So when we see our grandmas and grandpas struggling, it's just telling us that they need help mentally, they need some sort of emotional support. Because if they are mentally healthy and they are thriving, they are able to manage the stress, they are able to adjust properly to the stress, to the changes that are going on around them, the loss of a loved one that's eventually going to happen as they grow older, right? Grandparent will die before the other one. And that loneliness, coupled with the fact that their children are now out in the world, how are they able to handle those changes? I said all of that to say that in every stage of life, our mental health is either helping us to thrive or making life feel heavier. The work is in our hands. It's all up to us as individuals to do what we can at our best possible to check in with ourselves. How am I feeling? How is this affecting me? Do I need help? Is it time for me to reach out for support? Is it time for me to unplug and take care of myself? That's why caring for our minds is not option. It's not an option. It's not optional. It's not selfish. It's actually a necessity. It's something that is important in order for us to have a full life. So let me ask you these few questions. When you think about your own life right now, in this moment, how is your mental health? If you are going to rate your mental health on a scale of 1 to 10, what number will you be at? And when you answer that question, you can leave it in the comment section, you can answer it in your mind, you can write it down somewhere. You want to think of how well you are coping. Are you coping well with everything life is throwing at you? Or are you handling things with a very thin thread? Are you barely holding on? Are you giving as much care to your mind as you are giving to your physical body? I trust that if you were to wake up in the morning and you wake up with an excruciating pain in your chest, you call your worker and say, "Hey, I'm sick. I need to go to the clinic." You will go call your doctor, book an appointment, and go. If you wake up in the morning feeling overwhelmed with the work ahead of you, or just with everything life has thrown at you, and you know that mentally I need help, do you reach out for as much help as you would if it was physical health? So, how well are you taking care of your mind? How many vacations have you gone this year? How many times have you said, you know what? I've been working the past 4 days. I'm tired. I'm going to take today to rest. I'm stressed. I can't cope. What are the signs that you have noted in yourself? And that comes with knowing yourself. What are your indicators? What are those signs that tells you that you are stressed? What are those signs that tell you that you need to unplug? How well are you doing on that scale of 1 to 10? So I, I'm begging you, I'm pleading with you, take time once a week, every other day, once a day, whatever works best for you. But make sure you are intentional about pausing every now and then to reflect on how well you're doing mentally, reflect on how your body is doing, how your mind is doing, how are you handling stress, what's your resilience level on a scale of 1 to 10, where are you mentally? The good news about all of this is that your mental health can be strengthened. So let's say you had a rough childhood and you have learned or you have somehow become an adult who struggles with emotions, who is easily triggered, who doesn't know, who is not as patient as they would like to be. The good news is that your mental health can be strengthened. Just like our muscles, we need to work on it. You work on your muscles enough to build those muscles and have all the packs that you want to have. Same thing with your mental health. Work on it. Consistent, focused, intentional work on our mental health. Work on our mental health helps us to become healthy. Some ways to do that is to practice healthy habits like rest, like nutritious meals, gratitude, set boundaries and stand on them. I can't overemphasize that. Set your boundaries and stand on your boundaries. Follow through. Connect with people who are supportive. If you have 20 friends that you cannot call and say, hey, I need to chat, I just need to vent, it's time to look at your cycle again. So have supportive people in your life and take care of everything that matter to you, including your health. And when I say everything that matter to you, know that you are top on that list. Be your own priority. As I will say all the time, you can never pour out of an empty cup. So if you found this helpful, like it, leave a comment, subscribe, share to your friends and family, and let's continue to walk this journey to mental health together. Remember, together we build a community where wellness is not just a buzzword, it's a lifestyle. Self care is not considered selfish, it is actually important for us to thrive mentally. Thank you for watching. As I say all the time, you deserve to thrive and not just to survive. And I'll see you in the next one.